Gum disease treatment, scaling and root planing for improved oral health. Gum disease, also known as periodontal disease, is a common oral health issue that affects millions of people worldwide. It is caused by the buildup of plaque and tartar on the teeth, leading to inflammation of the gums. If left untreated, gum disease can progress and result in serious complications, including tooth loss. Fortunately, there are treatment options available to help manage the disease and improve oral health. One such treatment is scaling and root planing. What is scaling and root planing? Scaling and root planing is a non-surgical procedure that is performed by a dental hygienist or dentist to treat gum disease. It involves the removal of plaque and tartar from below the gum line and smoothing out the roots of the teeth to eliminate bacterial toxins. This procedure helps to reduce inflammation and promote healing of the gums. The scaling process. Scaling is the first step in the scaling and root planing procedure. During scaling, the dental hygienist or dentist will use a special tool called a scaler to remove plaque and tartar from the surfaces of the teeth and below the gum line. This process may take some time, especially if there is a significant amount of buildup on the teeth. The dental professional will use a combination of hand instruments and ultrasonic scalers to effectively clean the teeth. The root planing process. After scaling is complete, the next step is root planing. During root planing, the dental professional will use a tool called a curette to smooth out the roots of the teeth. This process removes any rough areas on the roots where bacteria can easily accumulate. By smoothing out the roots, the dental professional helps to prevent further buildup of plaque and tartar, promoting healing of the gums. Benefits of scaling and root planing. Scaling and root planing offer several benefits for patients with gum disease. Some of the key benefits include reduced inflammation. By removing plaque and tartar from below the gum line, scaling and root planing help to reduce inflammation of the gums. Promotes healing. The smoothing of the roots during root planing promotes healing of the gums and can help to prevent the progression of gum disease. Prevents tooth loss. By effectively treating gum disease, scaling and root planing can help to prevent tooth loss and preserve oral health. Who is a candidate for scaling and root planing? Scaling and root planing is typically recommended for patients who have been diagnosed with gum disease. This procedure is often the first line of treatment for mild to moderate cases of gum disease. In some cases, scaling and root planing may be recommended as a preventive measure for patients who are at risk of developing gum disease. Your dental professional will assess the condition of your gums and recommend the appropriate treatment plan for you. Post-treatment care. After scaling and root planing, it is important to follow the post-treatment care instructions provided by your dental professional. This may include brushing and flossing regularly to maintain good oral hygiene, using an antibacterial mouthwash to reduce bacteria in the mouth, scheduling regular follow-up appointments with your dental professional for monitoring and maintenance. It is important to follow these guidelines to ensure the success of the scaling and root planing procedure and maintain your oral health. Scaling and root planing is an effective treatment option for gum disease that can help to improve oral health and prevent serious complications. If you have been diagnosed with gum disease, talk to your dental professional about scaling and root planing as a treatment option. Remember to follow post-treatment care instructions to maintain the health of your gums and teeth.